10 signs in your feet that may reveal diabetes. Advice from a doctor. If there is one part of the body that is often forgotten during daily health checks, it is the feet. People take care of their face, hair, even their fingernails, but the feet, which bear the entire weight of the body every day, are rarely noticed. Yet, for diabetics, the feet act like a silent display screen, revealing many health secrets you might not expect. As a doctor, I often tell my patients, sometimes to know how healthy you are, don't look in the mirror, look down at your feet first. And here are 10 important foot signs that, if you or a loved one has diabetes, must not be ignored. Numbness, tingling, when the feet speak first. Have you ever felt like ants were crawling on your feet, or as if tiny needles were pricking them, even though nothing was happening? That's not imagination, but a sign of diabetic neuropathy. High blood sugar over time acts like a sweet acid stream, corroding and damaging nerve fibers. As a result, the feet gradually lose sensitivity to heat, pain, and danger. It may sound nice, no more pain, but in reality, it's the opposite. Without sensation, you may step on a nail, get burned, or scratched without realizing it. By the time you notice, it might be too late. 2. Swollen ankles, a warning bulb from the circulatory system. If one afternoon you take off your shoes and see your ankles ballooning, don't just assume it's from walking too much. For diabetics, swelling, edema, can be a reminder that blood vessels are in trouble. High blood sugar damages small vessels, slowing blood flow and causing fluid to pool in the lower limbs. Sometimes, swollen feet are also a sign that your kidneys are tired, a common complication of diabetes. Put simply, if your feet look like steamed buns full of water, take it as an emergency signal from your body. 3. Slow healing wounds, when a small cut becomes a big problem. A common situation for diabetics, a tiny scratch that refuses to heal even after weeks. High blood sugar reduces circulation and weakens immunity, making the body lazy in sending oxygen and nutrients to wounds. The result? A seemingly minor cut can turn into an infected ulcer, and in severe cases lead to gangrene or amputation. That is why doctors always stress, for diabetics, even a small scratch must be treated like a surgical wound. 4. Dry, cracked skin, when heels become a desert. Cracked heels may look like a cosmetic issue, but for diabetics, they are a medical warning. High blood sugar causes dehydration, making the skin dry and less elastic. Damaged autonomic nerves also reduce sweat production, turning feet into a cracked desert. The danger is that these cracks become gateways for bacteria, leading to infection. So if you think moisturizer is only for your hands or face, it's time to add your feet to the list. 5. Cold feet, not just a winter story. Some patients complain, annoyed, "Doctor, my feet are always cold, even in hot weather." This is a sign of poor circulation. When blood vessels narrow from atherosclerosis, warm blood no longer reaches the feet. Damaged nerves can also distort temperature perception. Your feet may not actually be cold, but your brain thinks they are. Unfortunately, the solution isn't just thicker socks, but controlling blood sugar and exercising regularly. 6. Skin color changes, signals from an unusual palate. If your feet turn red, bluish, or pale, it's a serious sign. Red may indicate inflammation. Bluish tones signal low oxygen, and pale skin shows poor blood supply. All are linked to peripheral artery disease, PAD, a dangerous diabetic complication. If your feet suddenly look like an odd color chart, treat it as a breaking news alert from your circulatory system, not just strange skin. 7. Hair loss on the legs, a rarely noticed clue. Most patients don't pay attention when hair on their toes or legs gradually disappears, but this is a classic sign of poor circulation. Hair follicles need oxygen-rich blood to grow. When supply is inadequate, hair falls out, leaving smooth, shiny skin. It may save you from shaving, but medically, it's a red flag you shouldn't ignore. 8. Pain when walking, not just tight shoes. If after walking a few minutes your calves feel tight, burning, or painful, this is called claudication. Pain from poor blood flow due to blocked arteries. For diabetics, it's an early sign of PAD. The danger is that many dismiss it as bad shoes or walking too much, allowing the disease to progress unnoticed. By the time it's detected, severe vessel blockage may already exist. 9. Foot deformities, a result of nerve damage. Some diabetics develop foot deformities known as Charcot foot. This occurs when nerve and muscle damage alters foot structure, causing uneven pressure distribution. This not only changes gait, but also creates abnormal pressure points, leading to calluses, ulcers, and infections. Thoughtful. In other words, it's not just about appearance, but a serious medical risk. 10. Fungal infections, a small but persistent enemy. Finally, fungal infections between the toes. Warm, moist areas perfect for fungal growth, especially with high blood sugar. The result? Red, itchy, cracked skin that's uncomfortable and invites bacterial invasion. If you think athlete's foot is trivial, for diabetics it may be the last straw leading to severe infections. The best prevention is to keep feet dry, change socks regularly, and use antifungal treatments as prescribed. Conclusion: feet are the body's most honest storytellers. After many years of practice, I've realized feet never lie. They reveal blocked arteries, damaged nerves, and weakened immunity. The question is, are you willing to listen? Daily foot care, stable blood sugar, and regular checkups. These are not just medical advice, but the secret to keeping your feet strong enough to carry you to new journeys in life. As I often tell my patients, love your feet, because when they are healthy, your world will be much wider.